Ladies and gentlemen, boys and girls, and children of all ages, welcome to another installment of NutraNews, which I'm sure you've been waiting for the longest time. I had something in my teeth there. Alright, so, I've been promising this, and now I'm dropping it. I recently had another surgery. Another surgery that honestly no one should want, but I wanted it, so I had it. And it wasn't a cosmetic one. Wasn't one that, as I said, no one should really want it. And to explain the context for the surgery and why it was necessary, we're going to need to go back in time and explore Jacob's life a little bit. The life of Jacob. And so I invite you to jump in my time machine a little bit, and we're going to do one of those little, little mirage things, and explore my life. So, we're going to go back, hop back to like maybe circa 1999, when, everybody's asking Jacob, what do you want to do with your life? What do you want to do when you grow up? And Jacob says to people, I got it. I want to be a professional wrestler and a professional dog breeder. I had a fascination with professional wrestling, and I also had a fascination with golden retrievers. I loved golden retrievers, and I also loved Stone Cold Steve Austin and The Rock, who they both had an intense rivalry. And then one day Chris Jericho comes in and wins the undisputed World Heavyweight Championship, and I hated Chris Jericho, thought he was the world's worst person, and now I love him. He's my absolute favorite. Fast forward to the year of 2012, and we catch up with Jacob as he is 22 years old, and Jacob is living with two other guys in an apartment in Evansville, Indiana on the west side. And although Jacob is not a professional dog breeder, he is going to college. And one of his roommates, his name is Jeff, he also has aspirations of being involved in professional wrestling. So Jeff starts going out and doing some research. Jeff goes out and sees if he can get involved in the business, and he meets a trainer who's starting his own wrestling company, independent professional wrestling company. And Jeff feels the guy out, thinks the guy really knows his stuff, and Jeff begins pursuing lessons with the guy, doing professional wrestling training with the guy. And this trainer wants more guys, wants more dudes, wants to make this show and the promotion a big success. And so Jeff comes up to me one day and says, hey Lehman, do you want to get involved? Maybe this is how much he charges for training. I don't know if you really have the money right now. I know you work a lot. I don't know if it works with your schedule or anything, but if you want to, you can come with me, check it out, see if this works for you. And so I said, you know what, why not? This was a dream of mine once, and maybe I can make it work. So I came out and I watched Jeff and another guy who wound up being a friend of mine. His name is Lucas. And I haven't seen Lucas in the longest time, but Lucas is a wonderful guy. I watched him, and I watched Jeff and Lucas. They did a spot in the ring. A spot is a term in wrestling where it's just a section of a match, essentially. And it was a very basic spot, but it was also very clean. It was they did a great job for what they did, and I was impressed. And I said to myself, in my own head, I said, Jacob, if you get involved in this, it could take you, upwards of a month, to get to where you just saw them. But if you worked hard enough, maybe eventually you could be on the same level as where you just saw them. So I said, you know what, I'll take a crack at this. I'll get involved. And so the legend of J.D. Lehman was born. Very inspirational ring name now, isn't it? Definitely inspires truth, justice, and courage in the hearts of men. When you hear the name J.D. Lehman, doesn't that just make you want to, get in there and fight for truth? Me neither. Anyway, I did have a robust cheering section from, for a couple of shows. Some friends of mine from Texas Roadhouse showed up and had my cheering section, and it was more than I deserved. It was fantastic. I had some great times. And Dallas, if you do not stick with the rug, I'm gonna drop a people's elbow on you. Anyway, had to address the cat. See how well the dog breeding has gone, right? So anyway, so fast forward a little bit farther in time. We get to late August 2012, maybe early October 2012. I was in training, and we were doing a 6-man tag team match, heels versus faces. And if you're not really familiar with the terms, a heel is a bad guy, a face is a good guy. I was chronically cast as a good guy because that was just apparently me. I just come off as a good guy to everybody, and so I was always painted as a good guy in the ring, although I desperately wanted to be a heel. It not only is it easier usually to play a heel, but I naturally just kind of gravitate towards a heel. That just really would have worked out for me. I'm always kind of sad that I didn't get to do that. But anyway, so I'm in the ring, and I'm working with a guy. I stand at about 5'8". The guy I was working with stands at like 6'4". And he throws me against the ropes, and one of the guys who was hanging out outside the ropes at that moment decided to give me what is called a kitchen sink. A kitchen sink essentially is supposed to look like a knee to the back. It's supposed to look like that. This one was a knee to the back. And disclaimer or insert thought right here. This is for everybody who is watching this video right now and is crossing their arms going, "Professional wrestling is so fake. That stuff is for wimps. It's for people who like to pretend that they're in fights and they're not really in fights, and they're just sissies who are never really ever in fights and they take no damage ever." I'm here to tell you that you're wrong. And this is why you're wrong. Because even though a kitchen sink is supposed to look like a knee to the back, this one was actually a successful knee to the back. And it hit my 10th and 11th ribs on my right side. And in that moment, I heard in my head the popping sound that was associated with them breaking. And I just, at that moment, I came off the ropes and I completely collapsed to the floor. The mats. I just completely collapsed. And I didn't know what had happened to me. I didn't know what had happened, other than I completely lost my breath. I didn't know what had happened. I was sure it wasn't good, but I didn't know how bad it was. And the guy I was working with picked me up, and at that moment, he decided to give me a beautiful elongated suplex. I mean, because he's 6'4" and I'm 5'8". I have the musculature in my core to basically do a beautiful just vertical. And so he gives me that suplex. I'm completely vertical, and onto my back I go with that suplex. It looked great, felt terrible, and it was at that moment that my trainer, who was converting to being a heel in our shows, decided to tag himself in, switched out with the guy I was working with, and he proceeded to give me 3 Irish curse backbreakers. If you don't know what an Irish curse backbreaker is, go ahead, watch a YouTube video of somebody doing it, and you'll get the idea. He gives me 3 of them, and third one happens. All I do is just helplessly slide right off of his leg. I couldn't do anything else. I just slide right off, and I'm just laying there on the mat. It's all I can do to breathe. And then, 3 seconds later, I hear a bang, and I look, and there's a guy standing right there. And I'm like, oh my God, what the hell? And And he just looks at me and he's like, Lemus, are you okay? Lemus is my nickname. He's, Lemus, are you okay? And I'm not really sure, but I just don't know. And he's like, just powder out. So that's what I do. I powder out. And, he doesn't have lawn chairs or anything. There's nowhere I can sit. It would be ground or nothing. I just decided to stand. So for the next hour of wrestling training, I'm just standing and just trying to breathe standing. And eventually training ends, everybody goes home, they all have lives. I mean, of course they're concerned, they're people, good people, they're concerned, but they've got lives, they've got to go home, so, no judgment. And my trainer, he's asking me questions, he's trying to figure out my symptoms and everything, and he is very smart when it comes to wrestling. He understands moves, he's studied countless performers and listened, watched interviews time and time again, just a junkie. And so he was starting to compare what I was saying to an interview that The Undertaker had done, apparently explaining what it feels like to break your ribs. Because The Undertaker's been there, done that. There's not a thing, there's hardly an injury out there that The Undertaker hasn't sustained in his long-lived career. God bless The Undertaker. So, what I was explaining, sounded exactly like The Undertaker breaking his ribs at one point, and my trainer was like, you definitely need to go get yourself checked out, because I think you, if nothing else, you've definitely bruised your ribs, but I think you've broken them. And so Jeff, my wonderful roommate, he took me down to an outpatient facility. I walked in, I told them what happened, I explained my symptoms. They took me to an exam room, and they're, oh my God, they're freaking out. And they're like, we can't treat you here, but we need to call you an ambulance. We need to get you to an ER. You might have punctured a lung. We don't know what might have happened, but we don't want to even x-ray you, whatever. We don't want to see you here. We need to get you gone. And I was like, wait yourself a split second. You are not putting me in an ambulance. I know how much an ambulance costs, and I know that there is not an insurance company that even entertains the idea of covering that cost. So I made it here in my roommate's truck, and if my roommate is okay with the idea, I think that if he will take me in his truck to an ER, I'll just go that route. And Jeff, being the wonderful and lovely and often selfless person that he is, he decided to take me in his truck to an ER. And I walked into the ER, I explained my symptoms and what had happened, and they freaked out. And they x-rayed me, and indeed I had broken my ribs. And not just, little bit, not just, little hairline fracture, not just a little crack. No, totally. They were clean broken, and not just a little. When I say clean broken, it's not like they had just kind of, clean broken. They were really separated from each other. Both the 10th and 11th ribs, they were really separated from one another. So, what do you do when your ribs are broken? You take time off from everything you've ever enjoyed. You put yourself in a chair, you swallow a bunch of opioids to try to mask the pain, and you try to heal. And that's what I thought I did. That's what I thought had happened. That's not what had happened. Most people do that. That's not what Jacob did. What Jacob did was Jacob formed pseudoarthroses. Now let me explain the process of what kind of happens in the healing process. And most people, I think, who have broken bones have had this explained to them. Those of you who have never broken a bone before, let me fill you in. First, what happens at the site of a fracture is cartilage bridges the fracture. The cartilage bridges, and eventually these terms are interchangeable. Some people will call it calcification, other people will call it ossification. Either way, that cartilage becomes bone. It becomes a bony matrix, and then eventually, your body, it's like the fracture didn't happen. It's exactly like the fracture never happened. It becomes bone, and you move on. That's just it. Maybe every now and then when the weather turns, you'll feel something. You'll swear you'll feel something. Oh, the weather's getting bad. It's gonna rain or something. I can feel it in my bones, because something happened. There's some truth to that maybe, but it didn't happen for me. The cartilage stayed cartilage, and it formed a pseudoarthrosis. In the 11th rib, it wasn't so bad. I don't feel it. The pseudoarthrosis is still there. I don't feel it because there's nothing there to tell me that I feel it. In the 10th rib, that wasn't the case because the pseudoarthrosis grabbed my 10th nerve. Let me tell you and fill you in on what the 10th nerve does. The 10th nerve, and you get the 10th nerve innervates on your left side and your 10th or on your right side, and it's responsible for muscle function in your abdomen, your legs, and your feet. So on my right side, it had gotten pinched in that pseudoarthrosis. So every time I went to do something like breathe, or bend, or twist, or anything at all, that pseudoarthrosis would act like a hinge joint, but it's a false hinge joint because obviously a hinge joint isn't supposed to be in a rib. You never want a rib to bend. That's not what a rib is supposed to do. So every time that rib would bend, that 10th nerve, which is supposed to be doing things like governing the function of my muscle movements in the lower parts of my right side, it would say, stop it! Stop it! So every time I'm breathing, every time I'm working out, every time that I'm working, every time I'm having sex, every time I'm having a bowel movement, every time I'm peeing, whatever it is, that 10th nerve is saying, stop it! Please! No more! We can't do this. We're not supposed to. So, for 2 years, I lived like that. And it's hard to find a surgeon that will operate on you when your rib is not, tearing apart a vital organ. If you've got a rib that's, poking into your lung or, damaging any other organ, then, a surgeon will absolutely go in there, take care of that rib. But if your rib is not going after an organ and you've just got nerve entrapment, there's not a surgeon out there that will go to your rib and take care of that problem. They just are. They're not a dime a dozen, I'll tell you that. So it took a lot of research to find a surgeon brave enough to bring me the pain relief that I so desperately sought. Eventually, I found him. His name is Dr. Timothy Pullman, and if you do a Google search on him, you will find one of the most amazing, brilliant, and talented surgeons of our age. And he is also one of the most humble surgeons that you will ever know. He is just such a wonderful person. I cannot say enough great things about this man. And in May of 2014, this wonderful surgeon opened me up, resected that pseudoarthrosis, and then he put that 10th nerve back into its place so that it could function the way that it had functioned for me for so long faithfully. And he relieved me of my pain. And for a time, I was totes pain-free. Totes. I was back to being me. Back to Lee. It was great. And I thought that it was, we thought that we were done. We thought we'd close the chapter on that one. And, that rib was supposed to remain an ununified, completely just, forever broken rib, but that was okay because it would never hurt. There was no reason it would ever hurt. There was nothing that would ever tell me it would be hurting. There was no nerve to tell me it would be hurting. Nothing. It was good to go. So it didn't stay that way. And there was no way to know that it wouldn't stay that way. There just wasn't any way to know. This is uncharted waters. Never before, or I don't want to say never, I'm sure maybe somebody or a handful of people have gone through this at least somewhere, but this is uncharted territory, at least in, for the most part. So there's no way to know what it was going to happen next. These two ends did begin to touch one another quite a lot. And in their rubbing each other, in their touching each other, they were, going to war. And these two ends, if you did an X-ray, what you would basically see is a nub coming off of the vertebra, and then the rest of the 10th rib, basically, with a space, 5 centimeter space between them. They were going to war with one another, just jousting, and they began to grow their own bone spurs. These bone spurs didn't even act like normal bone spurs. These bone spurs started growing downwards. And in growing downwards, they wrapped up the 10th nerve that had already been through more hell than a 10th nerve would ever normally go through. And they didn't stop there. They weren't satisfied with grabbing the 10th nerve and wrapping it around these bone spurs. No, these bone spurs were evil. They were hell-bent on causing me pain. They hooked themselves into the 11th rib, and that's what they were doing to me for 3 years of my life. And we've been through what that 10th nerve is supposed to be doing, right, everybody? We've been through that, right? So every time that I'm, walking, breathing, exercising, working in any capacity, having sex, having a bowel movement, taking a whiz, anything like that, my poor little 10th nerve is like, would you please just not be doing anything right now? It's all I can do to just sleep. But I can't even sleep. Sleeping is exhausting, and there's no comfortable position to sleep. There's nothing that I can do to even take the pain away. There's nothing out there trust me, there's nothing out there that could take it away. Not that I tried some of these things. I mean, I didn't try a lot of illicit street drugs or anything. I kind of had a safe bet that even if they did take the pain away, the consequences wouldn't be worth it. But anyway, so surgery, again. I went to Dr. Pullman and let him know what was going on. And he said that the nerve entrapment was probably, the reason why I was going through what I was going through. And he opened me up and he took those bone spurs out. And as he was taking the bone spurs out, little pieces and chunks of the 10th nerve came out too. It was just, it couldn't be helped. They were too far gone and they came out. And most of the 10th nerve is, it's still there. Most of the 10th nerve is still there. And most of it, as far as we know, is functional. And then additionally, another 5 centimeters of that 10th rib was resected so as to ensure that those two pieces, those two ends, can never again be in contact with one another. They cannot joust with one another. They will never see one another again. They are not allowed. They are in permanent, lifelong, until the day that I pass away, time out. They can't come back. Now it's just a front part, what we would call anterior, and a lateral side part. That's all that I have left of that right 10th rib. That's it. And then that nub. they're never going to see each other again. And good riddance. Screw them. Good riddance. And in the surgery, my right lung collapsed. It's reinflated, don't worry. Don't worry, it's back. I had a chest tube in my back. I guess we can call it a back tube, but it's technically a chest tube, but it was in my back. And that did not tickle, my friends. That did not tickle. But anyway, when Dr. Pullman came out to my family and explained everything that had gone on and everything that he did, he also remarked that he honestly had no idea how I was, standing. I don't want to embellish too much. I'm not Superman. I'm sure there are other humans out there definitely that could have what I had and could face every day and continue to function. But he said that he had no idea how I was standing, and quite frankly, it was terrible. It was absolutely awful, and it's a pain that few people have ever felt before. I'm sure others have felt something similar or exactly. We should have a support group. There should be a paper or an article about us in a medical journal somewhere. We should know about each other. I don't know. I think it would be neat. What I went through was absolutely disgusting and horrible and very dreadfully painful. And they ask you, like, on the pain scale, that typical thing at the hospital, on a scale of 1 to 9, or 10, how is the pain? Is it 6 or an 8? What is that? It's not there. It's on the amp. It's at a heavy metal concert. It's on an 11. It's the typical chart at the hospital no longer applies. It's on an 11, man. That's where it's at. And there are plenty of other people who certainly have gone through pain or are going through pain that is comparable or even worse. Even worse. There are definitely people who are, have cancer and are going through cancer treatments who I would say, that typical, 1 through 10, where's the pain? That doesn't apply to them. It's on the amp scale too. It's cranked up to 11, man. Stop it with that silly thing. It doesn't apply. It's cranked up to 11. Stop it. There are people out there who have pain that is comparable and or excessive to what I had. But what I went through, few people, if any, have experienced what I did. And it's interesting to note that one instance, just one moment in time, can set the course of a number of years or maybe even the rest of your life. Just one moment, one poorly placed knee to my back set the course for the next 5 years of my life and dictated just a wretched amount of pain to which I was, for different periods of time, I was prescribed to unsafe amounts of opioids. I'm very lucky that I didn't fall into pits and gutters chasing down, heroin here and there. There are definitely cases where people have found themselves in those situations and didn't receive the help that they needed. And it's awful. So I absolutely am very thankful for the surgery I've gone through. I'm very thankful to Dr. Pullman for what he's done. And I'm really looking forward to being done with this post-op pain, because I'm really looking forward to being me again. And I'm not even really sure what I am without my pain, actually. This pain, you know, it happened to me when I was 22. I'm 27 now. I don't know what I am without my pain. It's 5 years of my life. It was the better part of my 20s. I don't know what I am without it. It's weird. And I feel for people who are still going through a great deal of pain. Even if it's not pain that was severe as mine, or if it is pain that is severe, is as severe as what I was sentenced to, or if it's worse. I don't want to imagine pain that was worse than mine. I really don't want to imagine that. That's worse. That sounds terrible. But if it's worse, that you need to get that fixed. If you're watching this, I don't know who you are. If you're living with that, and if you're telling yourself that you can go through another day of gritting and grinding your teeth, of biting your cheeks, because I know what that's like when you just don't even catch yourself doing it until you just later, you wonder to yourself, how long have I been doing this? How long have I been biting my teeth against my cheeks? And you notice that the sides of your cheeks are rather raw, and you wonder if they're scarred at this point. Don't continue to do that to yourself and think that you can keep doing that to yourself, and that you can continue to wash, rinse, and repeat, and make it another day, another week, another month, another year. Don't tell yourself that. Don't continue to accept opioids or any other sort of medication from your doctor to just mask that pain. Don't accept anything less from your doctor than a solution to that pain. You need a solution. I don't know what that solution is, but you need a solution of some sort. I hope that you get it. I really do, and I don't mean to sound insensitive in any way towards it either. I know there are a lot of people out there who have like fibromyalgia or things like that, where pain just, doctors come off as sounding as though pain is now just your sentence for the rest of your life, and pain is now what you will just have to manage. And maybe your solution is pain management, and I do wish you all the best in your management, if that is truly the best solution that medicine can give to you. But if you have any other sort of condition, like something due to trauma or injury, something like mine, where there's a better solution for you than just management of your pain, then you need to find it. You need to seek it. You can't accept anything less than a solution to that pain. And I hope that you get it. I really do. And I don't know you. I don't know who you are looking for it or watching this, but whenever you find it, as you continue to try to seek it, know that I'm proud of you in whatever form or fashion that is. And I hope that helps. I don't know. I hope that helps. I want to do this additional thing for anybody else who's continuing to sit there with their arms crossed going, oh, that wrestling, though, it's a very fake thing. It's for people who, sissies that want to pretend they're in fights they've never been in a real fight in their life. Well, all right, Bruno. I got something for you. And if you're somebody who's easily disgusted by incisions and really nasty looking scars and stuff, then I would advise you go ahead and skip ahead in the video or cease watching this video at this point and go ahead and watch a video full of sunshine and flowers, because this video is no longer for you. Alrighty. And there you go. Yeah, there you are. Oh yeah, that's a nice one. That's my trophy for one moment in my life. Just one moment has led to this scar. Nice thing is he was able to use the same scar. That was the same one that we had in 2014. That was the same scar. He opened it up again. We used the same point of entry and glued me together. We're not using, stitching anymore. We're gluing now. We're gluing humans back together, by God. And eventually all that glue will wash away and all I'll have is my skin scarred back together again. And this is the last time we're going back in me. That was it. We're not going to have to revisit this again. That's it. And, so yeah. And, so the wrestling promotion I was in, it was a bottom barrel wrestling promotion. It doesn't exist anymore. A lot of the guys who were in it are still out there, in slightly better promotions or even bigger, better promotions, honestly. A lot of them very good guys, talented guys who are passionate about the craft, and I'm happy for them and the successes that they found wherever they found them. There are people, very good people, men and women, in bottom barrel, minor league professional wrestling, basically mid-level minor league professional wrestling, and even top level, minor leagues, and then all the way up there at the top major leagues, who go through absolute hell and back to give performance to audiences around the world day in and day out, and their bodies take absolute punishment day in and day out for that entertainment. It's something that you don't know how much it hurts until you get in there and do it, and to say that it's fake is just, it's wrong. I don't want to be mean or insulting, and I don't have to be. All I have to do is tell you you're wrong. I don't really watch MMA or anything like that. It's not really my cup of tea. I think it's kind of, it's just gross and grisly. It's just not my thing. But I do know enough about it to know that when these fighters get into the octagon, they only do it for, so often. They're only in there for minutes at a time, and I do mean minutes, and sometimes it's not even minutes, it's seconds, and then they space it out. It's like, months at a time, a month, 2 months, 3 months, sometimes it's 6 months in between that some of these even, top fighters get in there and face each other. And then when they're training, they're using the kid gloves. They're not doing real intense fights in the way that they would when they're actually facing their other competitors. It's not like professional wrestling where you get in there day in, day out. You're having matches that last bare minimum like 10 minutes, but for the most part you're getting there 15 minutes, 20 minutes. You're having these really long matches, and you're not doing it just for one night, 2 nights. You're doing it every day of the week. You're doing live performances on the road. You're getting hardly any sleep sometimes, and you're doing it because you love it. That's the thing. You're doing it because you love it. You love the entertainment. You love the craft. It's a completely different animal. Sure, you're not getting in there for a fight because you don't hate the other person. You don't have to hate the other person. And sometimes there actually is legitimate hate there, and sometimes that's when you get the best matches. But you don't have to hate the other person. And you don't have to get into a legitimate all-out brawl to actually get legitimate pain out of it. And if you in a good match, if you manage to get out of there without a serious injury, you still get out of there feeling like you've been in the fight of your life. I remember when I had my second match against my wrestling trainer, I got out of there in an absolute daze. I didn't know where I was. I was in my roommate's truck just with his passenger seat down, just like I had no idea where I was. I was disoriented. I'm not sure if I knew what time it was. I was just out. And I felt like I legitimately was in a fight, and it was incredible. And I wasn't injured after that match. I really wasn't injured, but man, I felt like hell. And it's not fake. And I know there's like a documentary out there on Netflix or Hulu where there's like some former washed up wrestler who like tries to expose the falsehoods or myths of professional wrestling. He's like, these wrestlers like landing on mattresses, and the ring is designed to help minimize the effects of the fall and blah blah blah. Nah, not really. The padding is like this thick, and it's really there just to like minimize like cosmetic damage, honestly, so you don't like get like really cut up or anything, because what's underneath of it is like just straight up plywood. And sure, the ring is a little bit springy, but it's springy so it's not like a trampoline, because if you were to land on a trampoline, it would be like you wouldn't be able to control your fall at all. You wouldn't be able to control yourself, your body. You would greatly increase your chances of injury. Honestly, landing on a trampoline, and when you land initially, wouldn't hurt because it does completely take away like the impact of your body's weight, but you wouldn't be able to control your fall. You would greatly increase your chances of breaking bones and such. So the ring is designed so that you control your fall. You're not going to break a bone necessarily, but you are going to feel the impact of your body hitting the ring much greater. And if you don't know how to land in a certain way, if you don't know how to tuck your head, time your breathing, exhale when you land, then you are going to hurt yourself much worse than what you're already going to feel when you land. So, and that's just one aspect of what you're going to feel in a match, much less all the other things that expose you to any sort of injury while you're in a match. And what I went through in just one moment in wrestling training is just one thing of the unique injuries that a professional wrestler exposes themselves to in training or in an actual match for the sake of entertaining audiences around the United States and around the world, honestly. There are countries the world over that have audiences that are just hungry for the sport, and honestly, of all the sports in this world, on this planet, it's professional wrestling that's growing the fastest. The NFL continues to lose audiences. Basketball seems to be doing pretty well for itself, and that's a good thing. Basketball is a good sport to be growing. Baseball has been kind of teetering, but professional wrestling has been growing a lot. People are hungry for it. The indies have been growing a lot. WWE is doing pretty well in most senses. So it's a very robust sport, and to see it grow is fantastic. And to call it completely fake, and to call the wrestlers who are involved in the sport fakers, is, like I said, you're just wrong, and you have no idea what you're talking about. Get in the ring, then tell me. then tell me they're fake. Um, so to close this off, to cap this off, I know it's kind of long. I want to open up the comments to a couple of things. I want to, this is NutraNews after all, and I want to get some nutrition involved here. My employer has given me an opportunity to do something that I want to start rolling out in January of 2018. He has asked me to do some small group workshops with nutrition counseling to patients prescribed to ADHD medication, and then also for patients prescribed to antipsychotic medication, such as antidepressants, anti-anxieties. When you have patients prescribed to ADHD medications, and let's ballpark, like I say, an extended release Adderall for 30 milligrams, or Vyvanse of 50 milligrams. And then let's say on the other side you have, antipsychotics like let's say a Wellbutrin XR or XL of like 20 milligram, what have you. So with the ADHD medication, not only do you have an appetite suppressant action, but you also don't even stop to think about eating. You don't even stop to think about being hungry. I definitely had that when I was first prescribed ADHD medication, where I didn't even stop to think I was hungry. I had no idea I was hungry. I had to teach myself how to eat again, essentially. How to recognize that even in spite of not noticing that I was hungry, it was time to eat something. And not only that, but an ADHD patient needs to focus a little bit more on protein because it helps to extend the action of the ADHD medication. And then when you have the antipsychotic patients, on the other hand, they're almost the exact opposite. Because of depression and anxiety, sometimes they are led, or actually most of the time, they are led by their disorders to eat a lot. And their medications can compound that and lead them to continue to eat even more. So you have to teach them to recognize and to teach them habits to stop eating so much. And then sometimes, and much of the time actually, because ADHD medications are notorious for causing anxieties, you can have ADHD patients prescribed to anti-anxiety medications, and now you have patients who are now in this middle ground where maybe now they've got complications of sort of both going on, and now out the window goes both things, and now you've kind of got to reassess. So I do know what I'm doing here. It's not like this is my first rodeo. I've done, my research, my homework. I know, some things, some tips and tricks. What I want to open up the comment section here is I want to hear your experiences. What works for you? What hasn't worked for you? If you are an ADHD patient, if you are a patient on antipsychotics, if you find yourself prescribed to both medications, what has worked for you in terms of your nutrition, your diet, your exercise habits? What hasn't worked for you? What have you been told that has worked for you? What have you been told that has not worked for you at all and you didn't really care to hear? And just leave that in the comments area. I would love to hear your experiences and your thoughts on that. And additionally, I'd like to hear pricing ideas too. I've got to find some way to price this out, because I live in Indiana. There's no registry for nutritionists here. There's a registry for dietitians. Dietitians can bill insurance. They can do all sorts of things like that. Nutritionists can't. We have no way to bill insurance. We have no way to register ourselves in the state of Indiana. Somebody who, somebody who maybe hasn't even achieved a GED could go out there and say that they're a nutritionist and start, seeing clients for nutrition counseling, and they would be well within their rights to do so in the state of Indiana. So, and then they could charge whatever they want. They could charge a fortune, they could charge $20, it doesn't matter. There's absolutely nothing to stop them from doing whatever they want to do. I'm not looking to scalp anybody. I'm not looking to get rich fast. I'm not even looking to achieve any sort of middle class status from this. I'm just looking to be fair and honest, and to use this as an opportunity to grow and maybe one day get somewhere better with this. What would you think is a fair thing? And I want you to be honest, not mean. What would you think would be a bargain basement sort of price? What would you think would be the highest you would go? Would $40 be reasonable? Would $60, $100? Where would you go on this? Keeping in mind that I also need to be fair to my employers as well. I've got to use their space. I have to keep the lights on. Part of this has to go to them. I have to be fair in that. I'm not naive, and I'm also not mean. By no means do I think all of this is going to me. And rightly, not all of this should go to me. So, if I was using my space and my own resources and my own electricity, things would be different, but it's not. So, I invite you to leave all these things in the comments, and I look forward to looking at them. And I also really encourage you to be respectful and courteous, and not rude or vulgar in any way. That's not what this is here for. Really, it's not. There's no reason for that. And if you are to be respectful and courteous in your comments, and I absolutely promise to be respectful and courteous in my replies, should I reply to you. I just really would appreciate any sort of input, in a respectful and courteous manner. And also, if you have stories of pain, be it current or past, and you need to get it out there in a respectful and courteous, way, and in a nice forum, I encourage you to put that out there as well, because something that I firmly believe throughout this whole experience is that there's strength in sharing our pain. There truly is. That we're not alone in our pain, that even if we have completely unique experiences in our pain, that if no one has gone through exactly what we've gone through for our pain, that there's definitely somebody out there who's experienced pain on a comparable level, and that we can all stand to benefit by sharing our pain, and that there's a lot of strength to be gained in that. So feel free to leave that if you are needing to do so. I welcome it. So, with all of that said, thank you for bearing through all of this. I certainly appreciate it. I know these videos run long, but I do them more for myself and for my family and friends than for anybody else. I don't do it to gain any sort of celebrity status of any sort or anything like that. That's not my purpose. Never has been. It's always just been for me and for others. And whatever comes from it is what comes from it. So thank you for watching this latest installment of NutraNews. Thank you for watching. Please like, share, subscribe, all that lovely stuff, and look forward to the next one. I love ya. Bye-bye.